My name is Peter Leighton, and I'm a board-certified internal medicine physician here at Bridgton Internal Medicine in Bridgton, Maine. My practice is going to focus primarily on addiction medicine, and that's addictions of all flavors, okay, with a particular emphasis on the opioid use disorders. And typically what I prefer to have done is to first have them evaluated by a specialist in the substance use disorder field. Okay, so typically we'll refer them to Crooked River Counseling simply because they're here on campus. There's other mental health providers who could also do the screening for me as well. And that way I know that they're appropriate for outpatient treatment. Because some patients who are addicted to opiates won't do well in the outpatient setting. And that's what buprenorphine was designed for. A lot of people have heard about methadone. Okay, methadone was the first form of medication-assisted treatment under the philosophy of harm reduction. So you're giving them an opiate, prescribed opiate, to keep them off the streets. But buprenorphine was designed to be used in the outpatient setting, not in a special clinic like a methadone clinic. And so it's really convenient for a lot of patients. They can continue to work. You don't have to travel to Westbrook or Portland or Lewiston to go to a methadone clinic. They see me at a minimum once a month, and they can get their counseling locally as well. So it's a really nice, convenient program. And the two things that I require, which I think are pretty straightforward, is I require honesty. Number one, it's very, very important to me that patients are honest. And the other thing I require is counseling. So I think it's pretty straightforward, and patients who are ready to be in recovery will do anything. So it's medication-assisted treatment. And that means that the real treatment is going to come down to the psychosocial aspect, trying to determine why an individual turned to using opiates in the first place, and working on different tools that they can use. So when they're tempted to use an opiate, they have those tools in their toolbox, so to speak. The medication portion, the buprenorphine, will take away their withdrawal symptoms without getting them high. So they feel normal. The opiate crisis, and I do believe this is a crisis, is a nationwide problem, and Maine has definitely not been spared. We're losing, on average, 1 Mainer a day from a drug overdose. I personally have lost 2 patients from a drug overdose. One patient actually left my practice for a year. One day when I was sitting here seeing patients, her mother came to me and she thanked me for saving her life, and understood that she made the decision to leave. And that just really brought home what I'm doing here. With all the barriers these patients have, many of them don't have vehicles, they don't have a job, they certainly don't have health insurance, never mind finding a doctor or a nurse practitioner or a PA who prescribes buprenorphine. The barriers are almost overwhelming. So because I feel so strongly about caring for this community, and in particular caring for this patient population, I decided that I really need to step up and spearhead the effort towards helping Mainers in Western Maine, but also being an advocate statewide and nationwide, honestly, in order to get these patients into treatment.